Chairman, thanks very much, and I appreciate you being here, Dr. Conway, and for your service at Cincinnati Children's.
Thank you.
Where, as you know, my wife is very involved and vice chair and incoming chair of one of our great children's hospitals. I wish I could say the same things about this proposal that I can about Children's Hospital. I am concerned about it, and I'm concerned about it for some of the reasons that have been stated already. And then I want to ask you about one specific deep concern I have about the specific proposal. First, it's called a demonstration. And yet, my understanding is going to cover about 75% of Part B medications, which is hardly an experiment. The control group is 25%. And I was just looking through some of the correspondence that I've gotten and letters, emails from some of my constituents. Tom Clark, his wife, is a cancer patient. He's very worried about her ability to get her cancer treatments. Barbara Lasky writes me a long letter about her immunodeficiency disease and what's going to happen to her. She's applying for disability now. She's already having a tough enough time. She wanted to do her infusions at home. She fainted at home. She has to go to her doctor. She's told if she goes to the hospital, it'll be much more expensive, and or they won't be able to afford to provide it. So just a lot of deep concerns about it. The specific concern that I'm hearing from Ohio is more about these community health centers and rural health centers. We've lost over 50 practices, physicians' practices, as you know, because you've been in Ohio. Going to the big hospitals. This will continue that and accelerate it. So I think this proposal, which is, again, not a demonstration, hardly, if it's 75% coverage, but it's a wholesale change, is going to really dislocate a lot of the people I represent and cause a huge concern among some of these smaller practices that are already having a tough time making it in the current healthcare environment with the Affordable Care Act. But let me ask you about something that concerns me about your specific proposal that perhaps you're not aware of. I assume if you were aware of it, you wouldn't be doing it. But this is a revenue-neutral proposal. And so you cut reimbursement for some of these, again, outpatient clinics we're talking about, some of these rural providers and so on, who are going to have a tough time making it. And you increase reimbursement in other areas in order to make it revenue neutral. One of the places where you increase reimbursement, as you know, is with regard to prescription drugs that are used for pain management. And specifically, you have a dramatic increase in reimbursement incentives for the kinds of pain medication that is addictive and that is causing much of the problem we have now with this opioid epidemic that we have in Ohio and around the country. And let me give you some numbers on that, just in case you're not aware of it. But on the expected impact on interventional pain management medication, you're seeing an increase of 46.9% and 33.7% versus a cut on hematology oncology drugs by minus 0.6%. So it's a dramatic increase, and I think the whole basis of your proposal is that if the reimbursement is cut, there's going to be less utilization, right? I mean, that's part of how you're trying to save money. And on the other hand, you are increasing reimbursements at a time when I think there's a general sense in the administration, certainly at HHS, because we've worked with them very closely, that there is too much overprescribing of certain kinds of pain medication that is addictive, that is causing so much of the opiate crisis. The Comprehensive Addiction and Recovery Act, which has passed the Senate by 94-1, deals with that overprescribing, as you know, including enhanced drug monitoring. I think there's generally a view at HHS this is a problem. We work closely with them. Senator Whitehouse and I are the co-authors of that legislation. This seems to run counter to that. So all the concerns you will hear from other colleagues, as you did from Senator Stabenow, Senator Roberts, and others about these providers is, of course, a concern of mine, and the fact that it's not a demonstration. But I have this bigger concern about the fact that under this proposed rule, which you say is to drive the prescribing of the most effective drugs, the reimbursement for this particular kind of opioids, this increase, could have a very negative impact and increase the problem with this opioid epidemic. For those who don't follow it closely, it is believed that 4 out of the 5 heroin addicts who are overdosing today, and 129 will lose their lives today on average, 4 out of 5 of them started with prescription drugs. And often it was for pain medication. It was, a prescription that they got because of a procedure. So could you briefly respond to that, Dr. Conway?
Yes, so 3 quick responses. 1 on the scope, we're evaluating the comments. We'll determine whether adjustments are needed. 2 on the practice issue. Overall, it is budget neutral, as you described. Overall, there's a slight shift in the impact tables towards the physician-clinician space. Specific thank you for your focus on the opioid epidemic. As you know, for the first time in U.S. history, we have zip codes in the U.S. where life expectancy is going down, and a large portion is driven by opioid issues. We will evaluate comments, including in specific classes of drugs. What you've named here is the fixed fee. So because the fixed fee is $16.80 as proposed, there's some very low cost, as you named, where the percentage increase looks large. So we'll have to look at that specifically and determine across classes of drugs, and you named one, are any adjustments needed in the proposals?
Yeah, just briefly, I'm sorry, Mr. Chairman, just one comment, if I could have an answer to this, maybe in writing. Fentanyl, as an example, is a big problem right now around the country. It's believed that it is causing more overdoses in Ohio, by the way, than heroin is right now. It's a synthetic form of heroin. As I look at this, it receives a 2,000% increase in reimbursement under this model, fentanyl alone. So I'm very concerned that we are going to incentivize increased utilization rather than the opposite.
And that is from the fixed fee, but we can give you a formal answer to that, but it's from the $16 fixed fee.
Thank you,
Thank you,
Dr.
sir.
Conway.